Joining us now is pulmonologist and public health physician, our friend Dr. Vin Gupta, who's also an MS Now medical contributor. Dr. Gupta, what do we need to know about this new variant, this flu variant called Subtype K that experts are warning about?
Well, yeah, I'd love for your audience to know that this is something that is actually shutting down schools, Anna, in places like Japan. We saw 6,000 preschools and other daycares shut down for parts of the last few weeks because of it. Similar, and not to that degree, in the United Kingdom and Canada. So this is serious. We're seeing these spikes in flu cases in kids, older adults that are higher risk, about 5 weeks prior to when we would typically see these spikes in these countries. So that's the worry.
The season's flu shot, that concoction, was created 4 months before this flu strain popped up. So is the shot still effective?
It is, but I would say a good flu vaccine, when we think about effectiveness, those numbers aren't like what we were talking about with COVID, 95% effective at keeping you out of the hospital. It's about half that. So 40 to 50%, it reduces that risk for those that are higher risk by about half. And that's what we're seeing here with this vaccine and this new variant that's changed since the vaccines were designed. So it's still really important to get vaccinated, really critical because it reduces your risk of ending up in the intensive care unit. But it's not perfect, and I think it's important to call that out.
And as we talk about how the flu season's off to an early start in places like the UK or Canada and Japan, what does that tell us about what we are in for? Are we typically just a little bit behind?
We are. And so we tend to lag what happens in other parts of the world, especially Oceania. So we should be prepared. And for all your viewers out there, for preparation purposes, know your body, know if you're unwell, present to care, especially, and I think we might have a full screen for your audience here. It's important that if you're high risk, over 65, underlying medical condition, if you have children under 2, just as an example of some high risk populations out there, and you wake up with flu-like symptoms, to quickly seek care, get triaged for flu, because Tamiflu, the treatment, is only effective, Anna, within those first 48 hours. Really important to get that in your body, especially if you're in one of these high-risk populations.
We got to run here, doctor, but do wearing masks help prevent the spread?
They can. And so if you're going to, if you have flu and you have to travel for, say, Thanksgiving, put a mask on. If you're worried about your own case, if you're worried about your own health and you're flying in a train, put a mask on. Of course, those things continue to help.
Okay, Dr. Vin Gupta, thank you. Good to see you.